Welcome to IST Presents. I'm JP Buenafé. The current pandemic is mainly a health crisis. The coronavirus typically attacks a patient's respiratory system and, if left unchecked, can lead to death. But apart from the patient's ability to breathe normally, the current pandemic is affecting not just the patients, but everybody around us, including ourselves, from a psychological perspective. So, how do we ensure that we are also safe and healthy in this aspect? Our guest today provides some insights on how people can cope effectively during the present coronavirus crisis. Dr. Anna Tuazon is a clinical psychologist and an associate professor at the Department of Psychology in the University of the Philippines, Diliman. Dr. Tuazon, welcome to our show.
Hi, thanks for inviting me.
Yeah, great. So maybe I'm sure yeah, we're in this uh, enhanced community quarantine for 6 weeks, 7 weeks running now, right? And I'm sure you've had some opportunities meeting, talking to people, being engaged in consultations. So
Mhm.
so far, what were the things or what were the biggest struggles that
Mhm.
people had to face during this time around from your own point of view as a psychologist?
Right. So, me as an educator, as a psychologist, and also actually as a supervisor of a psychological services program in the university, I think the first time this happened, right, the first time people had to be on quarantine, people thought it was just a regular suspension, right? Stay at home. And people tried to still do everything, right? Work, take care of the children, manage the household, and it was just a matter of doing it at home. And then now I think we're all realizing it's not as simple as that, right? We cannot really take on the same amount of workload and attack it in the same way. And so people are being overloaded, overburdened. The strategies they had, the coping that they had that used to work before doesn't anymore because we are in very extraordinary and very new, right? And we're in a very new situation. None of us have really had to deal with this kind of scenario before. Parents now have to take care of their children and homeschool all of a sudden, right? Suddenly, our internet connection alone is being tested to its limits. Going to the grocery store, the people are now likening it to going to battle and gearing
Yeah,
yourself
wow.
up. It now takes half a day, if not the whole day, to just get your basic needs. So definitely, what this means is everybody's stress levels have increased. Okay, no one is better off
Okay.
in this scenario. We have to understand everyone in their varying ways, right,
Mm-hmm.
is dealing with more stress and depending on the demand of their workplace or their school.
Mm-hmm.
um, Sometimes that doesn't it's not matching anymore, right? The
Mm-hmm.
demand is the same, if not more,
Mm-hmm.
particularly, let's say, for parents or for the basic needs that we have to do. The demand is higher, the stress is higher, and the resources are lower. So you don't need to be a psychologist to understand that that will result in a lot of distress, increased conflict, increased tension within families who are now stuck together, increased loneliness, isolation for people who have to do this by themselves or are alone or cut off
Mm-hmm.
from access. Yes, so wow, all sorts of stresses talaga.
Okay. And if you were to put, let's say, a number or a figure, I mean, I'm sure these things that you've mentioned, these were things that were already a problem even before the crisis came
Mhm.
about.
Mhm.
Uh, how much of these things increased? You said that stress increased. How much? I mean, if you were to give a figure, is that like two times,
Oh,
three times?
um, No, I am very hesitant to provide a number. Kasi, to be honest, it will be sort of guessing, right?
Yes,
Because we
yes.
don't really have a database. But maybe the numbers I can provide you is, for example, the UP Diliman Psychosocial Services, program in my university. We've been offering services to the general public, actually, beyond our students. We've been offering free services for the public, and since the beginning of the ECQ. And for now, we have, I think our last, we have serviced, no, we have a client demand of about 700 requests. Okay. And so that's just us. And we actually have a wait list. I think we're trying to
Wow.
whittle it down. We have a wait list of about, I think, 60 or 50 people. And so we're trying to get, we're trying to increase our capacity so that we can provide services right away. So those are at least the numbers I know I have information on. And when it started, very few callers. I'm telling you, very few callers, right? Because Filipinos, they're not used to seeking professional support and professional services. Maybe about 10, 5 people calling. Now we're having, like, there was one day we had 90 callers.
Wow.
20, 30, 50 callers a day. And by the way, we have increasing callers coming from the workplace, people who are burnt out and stressed. No, the work-life balance, which has always been a stress point for most adults, right, or study life balance for students, definitely exacerbated, right? So, yeah.
Okay, I mean, you've mentioned a lot of things. Perhaps the experiences, current experiences right now of people, loneliness, isolation. Um, uh, how is it? I mean, how is it now compared to when it was before? Um,
Mm-hmm.
I probably don't have complete visibility, right? But I would perhaps hear of situations wherein people may have had these problems before in the past, and
Mm-hmm.
now I think people are having more courage to actually, uh, how do we call this, report or consult with professionals.
Mm-hmm.
What changed in the last few years? Why is it that people now are more receptive to the idea of actually seeking professional help, especially in this
Mm-hmm.
situation?
Right. Actually, that's a very good point because in the last few years, we've seen an increase in acceptance, and acknowledgement that mental health is important, right? That it is really important for us to take care of our well-being. Um, so, and I think if I can pinpoint, actually, there's a sort of a milestone there. You could say a trauma milestone for the Philippines. When Yolanda happened, right? Typhoon Yolanda, Haiyan, back in 2014. Um, we saw that because before, people were saying, no, it's okay. We're very resilient people, right? They're always saying that Filipinos are
Yes,
very
yes.
resilient. We don't need help. We just need prayers. We just use humor. We have our families as support systems. So, and those are true actually, right? Like they're natural or sort of organic support systems that we have, organic resilience strategies. However, we realize, okay, there will be times we acknowledge, right? Haiyan was that in 2014, and now the coronavirus pandemic is another one of those where, okay, it's not a sign of weakness. It's not a sign of weakness among the Filipino people that we need more support, more help, right? It's actually the sign of how extraordinary the situation is. So, even in a way, seeking help now is much seems to be less challenging than back in 2014 because mental health awareness has actually stepped up quite a lot. We have the mental health law that is now enacted. So our progression also legally, institutionally, policy wise, funding wise, um, there's significant development. So with that, people are, we're not the only office, by the way, offering free psychotherapy services. There are a lot. I can send it to you for
Yeah.
further links and resources. Yeah, and people are taking that up. People are, accepting the support.
Okay. You've mentioned at least two population groups, the professionals and the
Mm-hmm.
students. Maybe let's drill down a
Yes.
little bit. I mean, what are the common struggles right now with the students? Let's start with the students. What are they complaining right now?
Right.
Yeah.
Oh, okay. So the thing is, so because we have this, we were able to see, like we have student clients, we also have adult clients, we have parent clients,
Mhm.
workplace, we have healthcare worker clients. So what we're noticing is that generally, students, especially undergraduate students, they actually have less resources, not just material, right? They have less
Yes.
ability to set up a private space for themselves. That has actually been a big barrier to them being able to get psychotherapy because, right, you need
Mhm.
privacy, you need your own rooms, your own space
Oh.
to be able to talk to your therapist without your parents around.
Ah, okay.
Um,
Okay.
right? So actually, a lot of students are they're finding it difficult to avail of our services because they're worried. They don't have the luxury of
Mm.
privacy. They don't have financial resources to determine, right, where to sort of purchase their own internet connection. We've had stories where they're not able to access internet because their parents prioritize the work, right? So parang
Mm.
last ka na for your lessons, mas
Oh,
important,
that's right. That's right.
right? The bandwidth should be reserved for the Zoom calls of the parents at work. So we're having those issues. And then, of course, again, I'm sure you're seeing it like
Mm.
this issue, this very, very tough, right? There's no pain free coping towards how then do you still learn in this
Mhm.
environment?
That's right.
How do you engage in formal study? How do you build skills
Mm.
necessary for your future profession? So that's really a problem. And then, of course, there's always a subset of them that already have pre existing psychological
Mm.
conditions, right? I think that I can give you a stat here
Mm.
about usually 1 in 3, right? 1/3 of the student population tend to have significant psychological conditions like
Oh.
depression,
Oh.
anxiety, a much lower percentage, but still meron yan, bipolar, right? Mood disorders, more biologically derived conditions that require medication. And by the way, most of our clients don't have access to this medication now because of the pandemic.
Mhm.
So they're struggling access to this medication. They've been cut off, right? But things that
Mhm.
are working for them. So they now have to experience the
Wow.
full brunt, right, of their distress, of their mood disorders,
Mhm.
and still have to perform as students, still have to do their responsibilities within the household, still have to deal with the interpersonal relationships that they
Mhm.
have. And if the family situation isn't so great, wow, right? They're faced with that, at their homes. So for students, wow, there's just a lot more problems, to be honest, than
Wow.
someone who's adult, who's in control of their immediate surroundings.
Okay. I mean, with the students, for old timers like me, we were raised in that environment. Whatever problems you've experienced, you tend to outgrow it. You learn from it. In other words,
Mm-hmm.
people, perhaps my generation, would be dismissive about these things. Do you see this? And do you see this as a change, perhaps in the mindset, or is the environment around
Mm-hmm.
us really changed significantly to actually cause this situation with the current students
Right.
nowadays? Yeah.
Okay. So one is we really cannot, at least what's happening now in the moment, we really cannot separate out the extraordinariness of our situation,
Mm.
right? Even the most self-sufficient, most independent, most emotionally regulated student or person can really get unmoored, in this
Oh.
kind of situation. Now, if you're talking about generational, differences in coping, um, I mean, in some ways, yes, right? Prior to this pandemic, meron na tayong nakikita. We're seeing really sharp increases, not in mental health problems. We're seeing that, in fact, the Gen Z, the kids that are in elementary now, will actually have significantly, are on track to suffer even more, to sort of have higher mental health problems than the college students of today. So unfortunately, we're in a very worrying trajectory now. Like they're increasingly vulnerable to significant mental health problems. Now, it's not just, yes, there's mindset, and the mindset is obviously influenced, as you said, right? There's something in the environment, something in the way our social systems are set up. One is that we have to understand, and I guess I'm a relatively an old timer as well. I'm not Gen Z at all. I think I was at the tail end of the millennial age bracket, though I don't feel it. It's really because I'm talking with young students, young kids also in my own practice. It's so much more competitive. This is what something adults don't really grasp, right? Is that the world of these kids, yes, they have more resources, right? They have access to the internet, they have more access to information, etc. And the competitiveness of the world they're preparing for is so much greater. Just think about the amount of knowledge they now have to learn that you and I didn't really have to learn then because the world hasn't discovered those knowledge. Di ba? Simple lang tayo. 9 planets, that's it. No new ones, right? Newton, Apple, gravity, that's it, right? Physics was sort of, at least elementary high school physics was relatively simple and straightforward. Now, physics that they're learning, right? Multiverses, string theory. Just sort of illustrate, right? The range of knowledge that they have to take in. So yes, the resources are higher, technology is greater, and the amount of skills and knowledge and resources they have to do. And by the way, this, right? The competitiveness of, I see a lot of kids with very existential concerns about the kind of work, the kind of careers, the kind of families and children they will raise. Like, I have 12-year-olds worrying about the job market for chemists because he wanted to become a chemist, right? Like he said, where's the job market for scientists in the Philippines? These are the things, you'd be surprised. Like the worries of children now are very, very grown up problems. These are not superficial. So I guess in sort of defense to the young people, right? Like there's so much, and again, maybe our education system. Let's take that on. You and I are both educators. In some way, there's a big imperfection, right, in how we teach students and children now. We don't really equip them with the skills to adapt to really fast changing situations. So this pandemic, for example, is a big test, right? Of have we equipped them? Have we prepared them to pivot in the moment and learn to roll with the punches? Clearly, in some ways, I have to admit, oh man, maybe we haven't really, right? We haven't really taught them how to bounce back. So a lot of reflection for us.
Yeah, and now let's take a look at the second population group I mentioned earlier about the professionals. How different are their concerns compared to the students, the children?
Yes. Okay. So actually, when it comes to disaster situations in general, we cite a certain age group as one of the most vulnerable. No, aside from children, alam natin, children and elderly usually vulnerable. But the age group also vulnerable are the ages 40 years old, around that age. You know why? Because some of them, most likely, they already have their own families to take care of and worry about. They have kids, right, that they have to take care of. They have their own households, and they have aging parents to take care of as well. And especially here in this pandemic, right? One of our biggest stressors. I have, retired parents, and my worry is their health and safety. So yes, adults, especially adults with families and working, juggling all of that now right? Is wow, is really such a Herculean task. And again, as I said, even something as simple as getting groceries or doing banking or right, paying your bills is now, which falls usually to those adults, right? It doesn't fall to the kids. The retired folks cannot do it anymore, so now you have to take on their their tasks as well. So yeah, their plate is also full and overloaded.
And I would assume, based on what you've mentioned now, with the current crisis, all of these concerns sort of magnified manyfold, right? I mean, they're concerned about their children having to continue earning a living at the same time taking care of their aging parents, especially now that movement has been very limited. Um, maybe maybe just a short explanation, or maybe give us a few insights on how both the students and the professionals can help themselves. What are the few things that they can add in their self-care toolbox, if you may, in order for them to really respond very effectively during this crisis?
So perhaps I'll start with the adults, and in some ways this will apply to students as well. No? Like it's very, very important to set time limits to work and study if you're a student, especially when you're working from home, right? If those who are working from home know this, right? Those who have to self-employed and are working at home even before the pandemic, this is a big there's a big tendency, right, for work to bleed in 24/7, right? We're now bosses are asking for reports on a Sunday night, right? They're asking for meetings at 8 p.m. on a Saturday, things like that. So it's really very important to set limits. If you are in a leadership position, it's so important, no? So ethical for you to set that tone, because employees don't, one employee, if you have a good relationship with your employer, right, it would be good to have that discussion. Right? Like, do we still expect to respond to emails? Everybody expects a quick response now. Everybody's multitasking, multiple meetings at the same time. So actually, we're doing more work than prior to the pandemic. So setting limits is very, very crucial. So, for example, in our work, I would say I will respond, once Monday is back. If it's a Saturday and a Sunday, unless it's a clinical emergency, I will respond on Monday, something like that. Very, very important. Now, the other thing is that people might not realize is you cannot expect yourself to be productive for 8 hours in a day. It's really not sustainable to keep an 8-hour workday, because it's not the same as before, right? Let's take note. Our stress level is up here. Our mental resources are down here. If you could aim to do 4 hours, I know it sounds maybe for bosses like what, but if you aim, you structure, you plan your day where it's 4 hours of focused work, that's actually way more productive. And I'm really, people can experiment this in their teams. If you just focus on 4 hours of I'm just gonna focus, lock the door, I'll talk to my kids after 4 hours. I suspect their productivity will be higher than you expect to work 8 hours and you're struggling. And remember, you have to do your groceries, you have to do the laundry, you have to help your kids with their homework or with their online lessons. That's why I think a 4-hour work day is way more productive. So just understanding your own limits, diba? Parang if nothing else, like all your strategies must emanate from the fact that I'm working on lower limitations. So I must do what is within. Because if you try to go beyond your limitation, your frustration and resentment will go up. Your temper will become shorter. Your sense of depression and isolation and loneliness and hopelessness, right? About like, when is this going to end? That's going to increase. And guess what? Then you can't work for the rest of the day. Right? So it works for health, it works for self-care, and it works for productivity. So it's not either or.
Okay.
Right? Mental health is not, right? It's not the opposite of workplace productivity. Same with school. Do one task in a day. Don't do 5 subjects like the way you used to do before, right? Trying to do the same, if you have the same time frame, if you have the same study table like a month ago, 2 months ago, that's wrong, right? That's gonna set you up to fail, and then you're gonna feel bad. Then, for people with mental health issues, they're gonna take it on as they're weak, they're not capable, guilt, self blame, all that. Let's remove that and say, cut it down to half, cut it down to 1/4 if you can. That would be that's the thing. Limit, compartmentalize. Yes.
Wow. Well, there are a lot of things that I'm sure you'd share with us today. Unfortunately, our time is quite limited, but nevertheless, you've shared so many things for us to consider. Well, it's been a pleasure to have you with us, Doc Anna. Thank you for sharing your thoughts with us.
Yeah. And thank you for having me, and hopefully I can, that some of what I said has been helpful
Yeah.
to some of your
And
listeners.
I know you've been involved right now with some support activities. Maybe you'd like to plug that in our show?
Yes. So for anyone who is feeling overwhelmed or feel like you don't have a safe space or safe person to talk to about these things, because perhaps talking to your boss, talking to your spouse might not feel like it's going to be safe. Or the UP Diliman Psychosocial Services is offering telepsychotherapy for free, okay, to anyone who's feeling distressed about this. I will share it with Chippy so that you can have the information connected to this video, or you can text or Viber UP Psych Serve at 0906 374 3466. Again, that's 0906 374 3466. Or you can also complete our intake form at bit.ly /PSYC SERVPH, PsychServPH. So that's bit.ly /PSYC SERVPH. I'll give the details to Chippy so you don't have to write it down.
Great. Thank you again, Doc Anna. Okay, and you stay safe.
Okay, you too. Okay, and have a balanced day.
Okay, great. That's Dr. Anna Tuazon of UP Diliman. If you have any feedback about our show, please email us at ist@uap.asia. I'm Chippy Benafe, and thanks for tuning in.